The job description of an ER nurse revolves around delivering urgent medical care to patients who arrive at the emergency room in critical or life-threatening conditions. Emergency room nurses are frontline healthcare providers who play a vital role in stabilizing patients, initiating treatment, and assisting in diagnoses under high-pressure situations. Their responsibilities require them to make quick decisions, multitask effectively, and remain calm under stress. Whether responding to trauma, acute illness, or chronic disease flare-ups, ER nurses must be ready for anything the moment a patient walks through the door. ER nurses work closely with physicians, paramedics, and fellow nursing staff to assess patients rapidly and prioritize care based on severity. Triage is a key part of the role, where nurses must quickly determine which patients require immediate attention and which can safely wait. As the first medical professionals to interact with patients in emergencies, ER nurses are responsible for gathering vital information, performing physical assessments, administering medications, and starting life-saving interventions when necessary. The job description of an ER nurse often varies depending on the facility's size and patient volume. In large urban hospitals, ER nurses may specialize in trauma, pediatrics, or cardiac care, while in smaller settings, they might handle a broader range of cases. Regardless of the environment, ER nurses are essential in maintaining the flow and function of emergency departments, ensuring that every patient receives timely, compassionate, and effective care. Core responsibilities of an ER nurse. The core responsibility of an ER nurse is to provide immediate, high-quality care to patients who may be experiencing anything from minor injuries to life-threatening conditions. One of the first tasks involves triage, where the nurse assesses each patient's symptoms, vital signs, and overall condition to prioritize care appropriately. This rapid assessment is crucial in a high-volume ER, where medical resources and attention must be allocated efficiently. Following triage, ER nurses perform thorough clinical evaluations, including checking vital signs, monitoring oxygen levels, conducting neurological assessments, and recognizing early warning signs of deterioration. They collaborate with physicians to implement treatment plans quickly and efficiently. This might include initiating intravenous lines, administering pain relief, conducting wound care, or preparing patients for diagnostic tests such as X-rays, EKGs, or blood work. Another vital responsibility is administering emergency medications and treatments. ER nurses must be skilled in using equipment like defibrillators, ventilators, and suction devices. They are also responsible for recognizing and responding to cardiac arrests, seizures, strokes, and other medical emergencies, often initiating interventions before the arrival of a doctor. In trauma cases, ER nurses assist in managing patients with injuries resulting from car accidents, falls, violence, or natural disasters. They must be proficient in emergency procedures such as intubation assistance, splinting fractures, performing CPR, and controlling bleeding. Accuracy and speed are critical, and documentation of every action must be clear and precise. Communication is an ongoing responsibility. ER nurses must communicate effectively not only with physicians and team members but also with patients and their families. In times of crisis, they are often the bridge between a frightened patient and the information they need to understand their condition and treatment options. Hygiene, infection control, and patient safety are additional responsibilities that cannot be overlooked. ER nurses ensure that all equipment is sterilized, personal protective equipment is used correctly, and patients at risk of infection are managed according to protocol. Midway through understanding the role, it's clear that the job description of an ER nurse is a complex blend of critical care, emotional support, fast decision-making, and precise execution under pressure. Essential skills and personal qualities. Working as an ER nurse requires a well-rounded set of technical skills and personal qualities that equip them to handle high-stakes, high-intensity situations. First and foremost, ER nurses must possess excellent clinical competence. They must be knowledgeable in acute care procedures, medication administration, wound management, and emergency protocols such as ACLS, advanced cardiac life support, and PALS, pediatric advanced life support. Critical thinking and problem-solving are essential. ER nurses often encounter patients with vague or rapidly changing symptoms. Being able to assess a situation, consider multiple possibilities, and act swiftly can make the difference between life and death. They must also interpret lab results, monitor responses to treatment, and escalate concerns when necessary. Resilience and emotional stability are critical traits. Nurses frequently witness trauma, suffering, and death. They must be emotionally strong to provide care compassionately without becoming overwhelmed. At the same time, empathy and bedside manner remain vital, particularly when dealing with patients in pain or distress. Communication and teamwork are also fundamental. Nurses work within a fast-paced, multidisciplinary team, where clear and concise communication can prevent errors and save lives. They must be able to follow instructions, voice concerns, and collaborate efficiently with doctors, specialists, paramedics, and social workers. Multitasking and time management are indispensable in the setting. Nurses may be caring for multiple patients simultaneously, all with different acuity levels and care needs. The ability to prioritize tasks without compromising the quality of care is a defining skill in this profession. Adaptability is another important quality. No two shifts are the same. An nurse must be prepared for unpredictability, whether that means handling a sudden influx of trauma patients or dealing with power outages, equipment malfunctions, or public health emergencies. Work environment and professional challenges. Nurses work in dynamic environments where every second counts. The emergency room is often loud, crowded, and emotionally charged. Nurses may work 8, 10, or 12-hour shifts, including nights, weekends, and holidays. Fatigue is a constant challenge, yet maintaining focus and performance is non-negotiable in this line of work. Physical demands are high. Nurses are on their feet for extended periods, may need to lift or reposition patients, and must respond quickly to medical alarms or emergencies. Protective gear is often worn for long durations, especially during outbreaks of infectious diseases. Emotionally, the work can be taxing. Nurses may deal with patients who are intoxicated, violent, or in extreme pain. They may witness death or deliver bad news to grieving families. Burnout and compassion fatigue are common risks in emergency nursing, making self-care and organizational support essential for career longevity. Despite these challenges, many nurses describe the job as deeply fulfilling. The opportunity to save lives, comfort families, and provide critical care in moments of great need offers a sense of purpose and pride that few other roles can match. Nurses often become advocates for their patients, pushing for better care, coordinating resources, or identifying social factors affecting health. This broader role enhances their impact on patient outcomes and community well-being. Education, certification, and advancement opportunities. To become an nurse, one typically needs to complete an accredited nursing program, earning either an associate degree in nursing, ADN, or a Bachelor of Science in Nursing, BSN. Upon graduation, candidates must pass the NCLEX-RN exam to become a registered nurse, RN. Many employers prefer or require emergency room nurses to have a BSN due to the complexity of care involved. Additional certifications specific to emergency nursing are often required or highly valued. These include the Basic Life Support, BLS, Advanced Cardiovascular Life Support, ACLS, and Pediatric Advanced Life Support, PALS, certifications. The Certified Emergency Nurse, CEN, credential, offered by the Board of Certification for Emergency Nursing, BCEN, is a widely respected designation that reflects advanced knowledge and professional commitment. For nurses seeking career advancement, options include becoming a charge nurse, nurse educator, or clinical nurse specialist. Others may pursue advanced practice roles such as nurse practitioner or nurse anesthetist, often requiring a master's or doctoral degree. Continuous education is a vital part of staying current with medical advances, trauma protocols, and healthcare technology. Workshops, seminars, and simulation training keep nurses prepared for the ever-evolving demands of the field. Conclusion. The job description of an nurse reveals a profession built on rapid response, medical expertise, and emotional strength. These professionals are the backbone of emergency care, offering hope and healing in moments of crisis. From triage to trauma, from medication to emotional reassurance, nurses deliver care that is immediate, impactful, and often life-saving. For individuals drawn to fast-paced environments, who possess a blend of technical skill and human compassion, emergency nursing offers a career filled with challenge and reward. Nurses not only stabilize patients, They support families, guide decisions, and stand as unwavering pillars in the most chaotic of moments. In doing so, they uphold the very essence of nursing: service, strength, and sacrifice.